So hello, everyone. My name is Noelle Wojciechowski. I am a neuroscience major in the Kilachand Honors College, and today I will be presenting my project, Mental Health at BU, a qualitative needs assessment of students with anxiety and related disorders. So what is an anxiety disorder? Well, first of all, we think about anxiety as itself an adaptive response to threats and danger. And in most cases, it can be helpful, but in cases of anxiety disorders, it is circumstances when this response becomes pathogenic and maladaptive. Currently, anxiety disorders disproportionately affect young adults and especially young adults in college. In a 2019 national survey, 24% of college students reported being diagnosed by a clinician with some sort of anxiety disorder in the past 12 months. So clearly there is a large portion of college campuses that deal with these issues. Unfortunately, anxiety disorders have led to an increase in the rates of suicides and hospitalizations among college students. And unfortunately, the COVID pandemic is just expected to exacerbate this already existing issue. A little bit of background on anxiety disorders. When I say anxiety disorders in this presentation, I will be referring to generalized anxiety disorder, panic disorder, and specific phobia disorders, as well as some related disorders such as obsessive compulsive disorder and post-traumatic stress disorder. Some of the symptoms that are generalized for most of these disorders are listed on the screen. But overall, the features that they share is this pathogenic anxiety response that can get in the way significantly of activities of daily living and functioning. Treatments for anxiety disorders include SSRIs and anxiolytic drugs in combination with certain psychotherapies, especially cognitive behavioral therapy. So moving on to anxiety at BU, I wanted to examine how students with anxiety disorders at Boston University interact with the university system and experience their time throughout undergraduate. So according to BU Behavioral Medicine and a yearly survey that they put out called the Healthy Minds Study, about 2/3 of the student body reports having felt extreme anxiety that has impacted their daily living at least once throughout the year. And the amount of students with diagnosed anxiety disorders is about close to that national average of 1/4. BU, in response to this, runs a behavioral medicine branch out of Student Health Services, and you can see their website front page here. These services offered as a part of behavioral medicine include assessment and diagnosis, short-term therapy and psychiatric consultations, 24/7 on-call service for emergencies, and referral to long-term resources for more intensive long-term care. So although there are no set number of sessions that are considered short-term therapy, if you are in need of longer-term care, more than a few weeks or a semester, they will refer you out to a provider in the community. So again, I want to see how students feel about these services because clearly the experience of having anxiety disorder while being on a college campus is a prevalent one, and it is important to understand it in order to paint a clear picture of student life at Boston University. So just to outline my goals, again, I want to understand the experience, identify the on and off campus resources that are utilized, and especially clarify the role that Boston University Behavioral Medicine plays in helping these students throughout their time at college. I also took my findings and wrote a report and have recommendations for policies that behavioral medicine may enact to help with the experience of students living with anxiety disorders on campus. So this study was a qualitative non-experimental design. It consisted of 30 to 60-minute interviews with participants who had been clinically diagnosed with an anxiety disorder. The questions that were asked during the interviews included questions surrounding ideas about getting to know the student, getting to know their experience with anxiety disorders. And you can see here just a snippet of an appendix from my report. You don't need to read all of it, but it just shows kind of some of the example questions that I asked in the interviews. You can see it's about not just the student as defined by their anxiety disorder, but rather how the student feels the anxiety disorder plays into their identity. And later questions also asked about their utilization of resources and treatments. For my sample, I was able to recruit 9 participants from various racial, ethnic, and socioeconomic backgrounds, various genders, and various gender identities and sexual orientations. I was able to do this through Facebook recruitment. So I posted the ads on Facebook saying to email me if they were interested, and people reached out to me. I also did forms of snowball sampling where I asked participants if they knew anyone who'd be interested and kind of got people that way. And so overall, for such a small sample size, I was happy with the diversity and the perspectives that I was able to receive. So now on to the findings of my study. So I found after I transcribed the interviews and coded them for themes that there were 2 major themes throughout the interviews that clearly defined the students' interaction with their anxiety disorder at Boston University. The first of these themes was long-term referral. And so specifically that long-term referral process that I detailed earlier, where students who were in need of longer-term care, which theoretically would be students who have a clinically diagnosed anxiety disorder, were referred from BU Behavioral Medicine to the outside community for more intensive therapy. And so there were difficulties surrounding this process that a lot of students outlined, and I'm going to give you some example quotes now. So I went to BU Behavioral Medicine. They gave me 3 referrals. One of the numbers didn't even work. The other 2 people were not accepting new patients. That, I think, was really discouraging. And from another student, it's hard. It's all of these moving parts, and you're constantly emailing people. And so many ones will say openings, and then you go on their specific website, and it's like, no, we don't have any, we're closed. So these were just the perspectives of 2 of the people I interviewed that I thought would be good to outline here, although this was echoed across many of the interviews. This idea of having a lot of difficulty with the long-term referral process, feeling that they weren't supported or that it was very confusing. And one student even described the process of dealing with trying to find a therapist while going through the height of their anxiety disorder as traumatic. So this was one of the major themes found. The other major theme that I found was difficulties with appointment scheduling. So currently, BU Behavioral Medicine only schedules appointments by phone call. So if you wanted to schedule an appointment, you have to pick up the phone, call, talk to someone, and schedule an appointment that way. And for 8 out of the 9 students I interviewed, they actually brought this up as a significant barrier to receiving treatment in the first place. A lot of students with anxiety disorders had anxiety about phone calls. And so this made it difficult for them to actually make that first appointment to try and figure out where to go as their first steps and enter the system to begin with. And again, I have some quotes. The only way to make an appointment is to call them. So it took me an entire semester to work myself up to call them. It took me a really long time to mentally dial the phone and call SHS to do it. And another student, I forced myself to call them, so that was already uncomfortable. The only way you could contact them was to call, and I think that was really insensitive. So what to do about these 2 issues that I encountered? Well, I found a few potential solutions and future directions that behavioral medicine could take. To address the first problem, I believe that increased referral support is needed, specifically in terms of staff. BU Behavioral Medicine currently has a referral coordinator, was hired in 2016 when the long-term referral process was kind of being ramped up and redone. However, clearly based on these responses from students throughout seniors, juniors, and sophomores that I interviewed, so pretty current data, this process is still not working for everyone. I believe that if there are more coordinators, first of all, the process by which students get the information, the lists of providers to call, could be kept more up to date. So there could be a comprehensive, more up-to-date list so students don't encounter calling people who are already full or who don't even exist anymore, as some of the students described. I also believe this would be very helpful because students having to call and get rejected time and time again while dealing with anxiety disorder and stress that comes from that was described as traumatic, which I think is something we really have to listen to in this case. And going off of that, calling in general. So I believe that there should be an online booking system for behavioral medicine Currently, Student Health Services has online booking for all of its other appointments. I'm sure we're all very familiar with BU Healthway, as we have to schedule our COVID tests twice a week through that website. And I believe that behavioral medicine could easily put itself on that website with the existing infrastructure in order to take away this barrier of students having to mentally dial the phone and call. I also, if behavioral medicine wouldn't want to use the Healthway website, I believe that they could use many other websites that BU already makes use of, such as something like TutorTrack for the Educational Resource Center peer tutor booking, or even youcanbookme.com online. I just think that there has to be a way for a student to more easily book an appointment without having to face down that fear of actually picking up the phone and dialing. I want to thank Dr. Carrie Landa, the director of BU Behavioral Medicine, Dr. Carrie Preston, the director of Kilachand, Rick Tinetti, the administrative and business manager, as well as the BU Kilachand Honors College and the undergraduate program in neuroscience for all of their support. Without them, I wouldn't be here and this project would not exist. So thank you. Are there any questions?